Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health, and I'm joined today by Bobby Peterson, who's going to help walk us through the American Health Care Act. And Bobby, why don't you just tell us what it is we're talking about?
Well, this is a new bill that was produced by mainly the Republicans, only the Republicans, to repeal and replace the Affordable Care Act. It's a relatively arcane process because they have to use a limited provision called the Budget Reconciliation Act in order to get it through the Senate with only 51 votes.
So it's a way to kind of circumvent the way a traditional bill would be introduced and run through the House and the Senate. And instead, this is kind of a shortcut by tying it to a budget measure.
Coincidentally, it's the same way the Democrats passed the ACA way back when.
7 years ago.
Right.
Yeah,
7 years
almost exactly.
Coming up on the 23rd of this month. But a key element of this right now is that there's no Congressional Budget Office estimate on what the costs are. So that's huge. I mean, this is, a key element of the Republican plan is that they're going to make it less costly. And of course, it looks like they did. But what is the ultimate score from the Congressional Budget Office?
And so this is just another one in the category of repeal and replace. The House is pretty active at trying to repeal the Affordable Care Act, and this is their most recent, introduced on March 6th. It is a bill that goes through budget reconciliation instead of the traditional process, and in an unusual step, they didn't wait to get the cost estimate or to see how many people would be cut. That's kind of an anomaly than from the way we're used to seeing legislation happen. It makes some pretty big changes to Medicaid.
It's pretty negative. I mean, it's a pretty bad, could have been worse, but this is pretty bad. It negatively transforms Medicaid from an entitlement. This is a guarantee that the federal government and states have had with people for over 50 years now. We were going to pay for your health care under our rules and requirements, but it transitions it to a per capita cap by 2020. So that's different than an entitlement.
Right, and it's different than a block grant, which is what people were fearing, but it's kind of like a block grant.
It's a kiss and cousin to a block grant. In some ways, it's a way of limiting the amount of money that's available to the states. It fluxes a little bit based upon the number of people in the program, so it's giving you money based on the number of people in the program, but it still has an upper level cap.
So in a lot of ways, this is a measure to, the words they were using was give states more flexibility, states' rights argument, while reducing the burden on the federal budget. Say states were capping the amount of money. They did give a little different allotment based on the category of consumer in the Medicaid program. They carved out 4 groups: children, elderly, and those with disabilities, the ACA expansion group, and then another category, which is kind of a catch-all, instead of throwing everybody under the same per capita limit, which some people had also feared. There's more that happens with Medicaid. Why don't we take a look?
Well, I mean, I think from my perspective, it's going to be, this is rationing of health care in a way. It's putting a cap in. States could run out of money. Categories could run out of money. There's a lot of mischief that could happen here under the entitlement that is much less likely to occur. And so I think we need to make sure that people recognize that this is a threat. Yeah. It's a threat to a lot of folks. In Wisconsin, it's 1.2 million people that are in Medicaid or variations, up to 1.2 million people in Medicaid or variations of the program. So it's a big deal.
And there's actually penalties if there is a state that's going to be exceeding their cap. So it's not just a slap on the wrist, but it's a very strict limit to the program.
It's a mechanism for budget control, but it's really way too punitive and it could harm people. It takes away the essential health benefits that were a part of Medicaid that were reformed with the Affordable Care Act. It repeals essential health benefits, so it gives states much more flexibility to design their programs in ways that might not include some really important benefits that most of us by now think are fundamental.
Right. It gets rid of the Medicaid expansion, which a lot of governors, Republican and Democratic, have spoken out of saying, trying to protect that piece of the Affordable Care Act.
It gets rid of the option for people to expand Medicaid, but it has some transitions from states that have already expanded Medicaid and tiers the funding down, I think, by 2026 to more of a 50-50 split between the federal government and the states.
So Wisconsin, as one of the states that did not accept federal funding to expand Medicaid, we would be in a position where we would not be able to all of a sudden decide we wanted to under this proposal. It also redetermines eligibility for folks that do have Medicaid expansion right now. A lot more restrictive redetermination of eligibility every 6 months instead of annually. And that's one of those bureaucratic hurdles that you put in the road for families just to make them reprove their eligibility every 6 months. We know from our experience that you lose people at these transition points. And there did seem to be, again, because no CBO report, a lot of justification for showing that this was a necessary measure.
And there are requirements to report changes in income and fluctuating. I mean, we have enough issues, but the actual
this is on top of that.
Is much more bureaucratic and a stumbling block that is in the path of a lot of people that need services.
Sure, and then it plays with some enhanced matching. It kind of repeals some of the provisions that were to encourage getting more new enrollees into some of the Medicaid programs. Let's finalize our talk about Medicaid before we move on to what it does to private insurance. And one of them is reverting the Medicaid eligibility for children from a more generous 138% for other states back to 100%. So there was an enhancement that was done that kind of started mixing the world of Medicaid and CHIP for a lot of children to make sure that they were in the program. And this is kind of rolling that back a little bit.
Right. And that's, of course, going to make it more difficult for people to transition into these programs, understand the programs that they're already in. More fluctuations in the healthcare marketplace for people trying to find their way through it. There's a lot of confusion right now. Some people think this stuff has already happened, and it hasn't. These are just proposals.
Right. Well, the last thing it does, and this hasn't been talked about too much, but it limits certain retroactive coverage effective dates for Medicaid. Badger Care Plus in Wisconsin, if you apply for Badger Care Plus, you could be found eligible 3 months prior to the month of application. Your application date actually goes back in time to cover some of those early bills you might have acquired if you would have otherwise had been eligible had you applied in those months. This now limits retroactive coverage just to the month of application.
Right. And that flexibility is harmful because a lot of times people might be crossing over from the middle of the month. They might not realize that they're eligible. Their income drops because they stop working. There are myriad factors that make this flexibility really important. This lack of flexibility will result in medical debt, uncompensated care, and we all share in that burden.
And hospitals, too, might be a little upset with this. Their first encounter with the patient is now going to be an amount due instead of finding and securing coverage that could actually cover that first encounter.
Yeah, the American Hospital Association has come out in opposition to this, as did the American Medical Association and many other groups. I mean, as I said, this is a pretty bad bill.
Right. Let's talk about what it does to private insurance. And this is what most people are talking about, is the repealing of the individual mandate, not just moving forward, but going back in time to January of 2016. It does the same thing for repealing the employer mandate. It changes the whole way that tax credits and tax subsidies work.
Tilts it much more to the benefit of wealthier individuals. It looks at age instead of income as a major determiner of your tax credit.
Which the AARP has just come out as saying that this is not a step forward for...
It's bad news for older adults, too.
Sure. It gets rid of things like cost-sharing reductions, and it actually is playing with actuarial values, which is why cost-sharing reductions disappear. And it repeals the small business tax credits starting in 2020, which is, you're going to have a lot of small businesses that were counting on that boost and providing insurance to their employees.
Well, it was a major incentive. It was rewarding small businesses that provided insurance to their employees, and taking that away, it's going to hurt.
It's going to do a couple things, create some new elements. So we talked just now about some of the things that repeals or gets rid of. It creates continuous coverage requirements with really enhanced penalties if someone does go for a time without insurance.
Right. So it's a distinction between the mandate of requiring people to have insurance. Instead, they're saying if you have a break in insurance, to get back in, you're going to have to pay a 30% enrollment penalty. So, I mean, there's the mandate, but this is trying to create a different mechanism to make sure people maintain coverage. So it's just a horse of a different color in some ways.
And some of the details aren't even fleshed out yet about how some of this works under the language of we're going to instruct the Treasury to create some system to make sure that these tax credits can be delivered. That hasn't really even been established yet, but they know they want more flexibility in tax credits. For example, letting people that don't even use the marketplace get some sort of little bonus for having purchased insurance. So it really is trying to get rid of that marketplace bill's concept is that being the place to go to and just opening up the market a little bit more generally. Creates a patient and state stability fund. And there's a laundry list of things that states could do with a little enhanced infusion of money to try to stabilize their market. And they give some suggestions of what that might look like.
This, marketplace stabilization was in the ACA. It looked different, but the Republicans really cried that this was a handout to the insurance industry. It was, corporate welfare. It was so terrible. And now we see it reappear here because at some point you need some mechanisms to help stabilize the markets as we transition. Some of the things in it include help to states to develop high-risk pools for individuals. We're going back to healthcare segregation. Let's take people that have pre-existing conditions and disabilities and put them in a high-risk pool. This is the old way. Practicing in this area for nearly 30 years, I've seen how this works. It's not great. It's not great for people. Let's get that blended pool. There's, of course, there are going to be some sick people, some very healthy people, but you blend it together and it makes financial sense.
It includes provisions for more autonomy for agents and brokers, no surprise, as well as flexibility for health savings accounts. And this is one of those talking points that we've heard a lot about, of creating health savings accounts and encouraging people to put money aside in a rainy day fund should there ever be a healthcare issue.
So good news for the healthy and the wealthy. You're going to have health savings
for all those
accounts
people with extra cash they can store away.
But if you have medical conditions and you don't have a lot of money, it's not going to do you a lot of good.
Right, and that's exactly what our conclusions of some of the shortcomings of this new bill, the new proposal that's going through the Ways and Means and the Energy and Commerce Committees right now, is that it does support the wealthier individuals. There's a lot of penalty for being low income and or having disabilities and trying to get covered.
Right, and as we've said, it segregates people, it rations care for the poor and people with disabilities. There's fewer people that are going to be covered by Medicaid, and that's bad news. I mean, when we expanded coverage to almost 30 million people across this country, it had a dramatic impact, created resources in Wisconsin, helped with health care infrastructure, and now we saw uncompensated care drop in Wisconsin by nearly $600 million from 2013 to 2015. What's going to happen now? Increase uncompensated care. Bad news for the state, bad news for consumers, because we all pay for that uncompensated care in some manner.
You can read these bills yourself. There are two different versions, the one going through the Energy and Commerce Committee, the other one going through Ways and Means. You can read them yourself. We have the links to them if you click on that information button on your screen. We also shared a couple other documents. Health Affairs blog post, Timothy Jost did a really nice job of breaking down some of the new provisions. He focuses a little bit more on the private insurance side. The NASHIP side-by-side comparison might be of really a lot of interest to a lot of folks. It puts the Affordable Care Act provisions side-by-side by the bill that we're talking about today. So you can actually line by line see what some of those changes look like. A great way to compare and learn a little bit more about what this bill does compared to what we have right now. And you can always share your Affordable Care Act story with us or what you're hearing from the families you're talking to. You can click on that information button to send us a note, or you can also visit our website at healthwatchwisconsin.org to share that story. Thanks for joining us. Thanks for joining me. We'll keep talking about this and answer any of your questions that come up along the way.
We give the new bill the big thumbs down.
Two thumbs down.
Thanks for joining us.
Bye-bye.